You are lying on a narrow table. The air is cold, sterile, and smells faintly of antiseptic. Above you, bright lights blur into halos, a mask is placed gently over your face, and a calm voice tells you to count backward from 10, 10, 9, 8, and then nothing. You don't reach 7, you don't dream, you don't simply sleep, you vanish. For the next 2, 4, maybe 6 hours, you do not exist. And this isn't sleep. Sleep is a restorative cycle of rhythms and dreams. And what happens on that table is a reversible, drug-induced coma that brings you closer to the edge of death than any other routine experience in human life. It is a procedure performed millions of times a year, every single day, in hospitals right down the street from you. We trust it with our lives, yet for nearly 200 years, we didn't truly understand how it worked. We knew that it worked. We could turn you off and turn you back on, but the how was a mystery. But that has changed. The research coming out in 2024, 2025, and now 2026 has radically altered our understanding of this state. We now know that going under is not just a switch flipping off. It is a complex, active dismantling of your reality, a chemical decoupling of your mind from your body, and a journey into a void that researchers are only just beginning to map. If you've ever wondered where you go when the lights go out, or if you or a loved one are facing surgery soon and want to feel empowered rather than afraid, I need you to stay with me for this entire video. We are going to walk through every second of this journey, from the first molecule entering your vein to the moment you open your eyes. This knowledge is not just fascinating, it changes the way you see your own brain. If you find value in understanding your health at a deeper level, please take a second to hit that like button and subscribe. It truly helps us bring this kind of deep dive medical research to more people who need it. Before we dive in, I want to give you a quick authenticity promise. Everything I'm about to tell you is not just my opinion. It is based on the absolute latest research from top medical institutions like the American Society of Anesthesiologists, major university research centers, and peer-reviewed journals from 2024 through 2026. I've listed all those sources in the description below so you can verify everything yourself. You deserve facts, not fear, and that is exactly what we are going to cover. Let's start at the very beginning, the induction. This is the moment the drug enters your system. Most often, the drug is propofol. It looks like milk and it moves fast. Within seconds of the injection, you might feel a strange sensation, a sharp burning heat crawling up your arm. For years, patients were told this was just irritation, but we now know it's something much more specific. The propofol molecule is hijacking a specific sensor in your blood vessels called the TRPA1 receptor. This is the exact same pain receptor that reacts to wasabi or mustard oil. Your body is screaming that there is a chemical intruder, but before that scream can reach your conscious mind to register as pain, the drug reaches your brain and shuts the message down. Right after that burn, you might taste something odd, metal. Some patients describe it as sucking on a penny or a sudden whiff of something chemical. This happens because the drug circulates so incredibly fast, from your arm to your heart to your tongue, that it actually stimulates the taste buds and the olfactory nerve in your nose from the inside out. It's a phenomenon called dysgeusia. It's your brain's last sensory report before the connection is cut. And once that connection is cut, the world doesn't just fade away, it deconstructs. This is where the new science gets incredible. We used to think anesthesia just dampened all your brain cells at once, like dimming a light switch. But 2026 research describes it more like a fragmentation. Your brain has a refresh rate, a rhythm that predicts what is about to happen next. When you are awake, your brain is constantly predicting the world. Under anesthesia, that rhythm collapses. The drug, specifically acting on the GABA receptors, prevents your brain regions from talking to each other. Think of it like a choir. When you are awake, the whole choir is singing in harmony, guided by a conductor, the thalamus, a small egg-shaped structure deep in the center of your brain. Anesthesia doesn't silence the singers, it isolates them. It locks the conductor in a room. We call this thalamic isolation. The singers, your cortical neurons, are still humming, but they are out of sync. They can no longer form a unified song, so you might still have electrical activity in the part of your brain that processes sound, or the part that processes touch, but without the conductor to link them together, you are not there to experience it. This leads to a specific brainwave pattern that doctors look for on the monitor, something called alpha anteriorization. In a normal resting brain, alpha waves, which are associated with idling, are found in the back of your head. But under propofol, these waves rush to the front, to your forehead, and it acts like a shield, a hypersynchronous buzz that prevents your frontal lobe, the part of you that thinks and plans, from receiving any information. From the rest of the world, you are effectively cut off from your own senses. But here is where the story gets more complex and perhaps a little unsettled. So we have to talk about the concept of hidden consciousness. For a long time, we assumed that if you weren't moving, you weren't there. But we used drugs called paralytics, neuromuscular blockers, during surgery to keep your body still. This means that even if your mind woke up, your body couldn't signal for help. This is the stuff of nightmares, I know, but please listen to the context because it's important. Recent large-scale studies, including some groundbreaking work from the University of Sydney and international consortia, have used something called the isolated forearm technique. Doctors put a tourniquet on one arm before the paralyzing drug is given. That arm stays awake while the rest of the body is frozen. They found that in some cases, depending on the study, anywhere from 4% to 10% of patients could still squeeze the doctor's hand on command after they were supposed to be unconscious. Now, before you panic, there is a massive difference between connected consciousness and awareness with recall. The vast majority of these patients, almost all of them, forget this response immediately. The anesthesia causes profound amnesia. They squeezed the hand, they followed the command, but 5 minutes later, the memory was wiped clean. They wake up with zero memory of the event. It raises a deep philosophical question. If you are aware for a moment, but forget it forever, did it matter? Medical ethics is wrestling with this right now, driving a push for better brain monitors that use AI to detect these hidden states better than ever before. Speaking of deep questions, 2024 and 2025 gave us a potential shift in physics. A study from Wellesley College provided experimental evidence for a theory that was once considered fringe. Quantum consciousness. They found that anesthesia might not just work on receptors on the surface of the cell, but on microtubules, tiny structural scaffolding deep inside the neurons. These microtubules are theorized to hold quantum vibrations that might be the physical basis of consciousness itself. The researchers found that when they stabilized these microtubules, it became much harder to put the subject under anesthesia. And this suggests that going under might actually be a dampening of the quantum state of your brain, literally reducing the quantum coherence that makes you you. It's a mind-blowing concept that links the medicine of the operating room to the physics of the universe. But let's come back to the biology. What happens to your brain after the surgery? Is there a cost to this journey? You might have heard of chemo brain. Well, researchers are now looking closely at anesthesia brain or postoperative cognitive dysfunction. In older adults, the brain can remain foggy for weeks or months. The latest research points to neuroinflammation. The stress of surgery causes your body to release inflammatory markers. In a young, healthy brain, a barrier keeps these out. But as we age or under deep anesthesia, that barrier gets leaky. These markers cross into the brain and irritate the hippocampus, the memory center. This is why we are seeing a massive shift in 2026 toward brain-sparing anesthesia, using precise monitoring to give you exactly the dose you need and not a microgram more, protecting your cognitive future. So the surgery ends, the gas is turned off, now begins the reboot. Emerging from anesthesia is not the reverse of falling asleep. It is a chaotic, non-linear process. Your brain is trying to jumpstart a stalled engine. And the order in which you come back is surprising. Research from the University of Michigan and others has shown that your higher executive functions, the CEO of your brain, often switch on before your sensory processing is fully connected. And here is the most comforting and important piece of practical advice I can give you. Hearing is often the first sense to return. Your ears are on long before you can open your eyes or move a finger. The primary auditory cortex is incredibly robust, This means that as you are lying there, unable to move, drifting in that gray space, you might hear the doctors talking or the nurses calling your name. You might feel fear because you can't move yet. This is sleep paralysis in reverse. But know this, it is normal. It means you are safe. It means you are coming back. If you ever have surgery, ask your surgical team to speak kindly to you as you wake up. Tell them I might be listening before I'm looking. It matters. The future of this field is moving incredibly fast. We are entering the era of AI-driven anesthesia. Closed-loop systems, essentially an autopilot for your brain, are being tested right now. These systems read your brainwaves in real time, thousands of times a second, and adjust the drug infusion instantly to keep you in the perfect sweet spot, deep enough to feel no pain, but light enough to avoid the side effects. It's safer, cleaner, and more precise than human hands alone could ever be. So what really happens when you go under? You embark on a journey where your biology, your consciousness, and the laws of physics intersect. You give up control to gain a life-saving procedure. It is a profound act of trust, but armed with this knowledge, knowing about the burn, the reboot, the hearing, and the safety nets, you can walk into that operating room not as a passive patient, but as an informed partner in your own care. Your brain is resilient. It is built to come back, and modern medicine is better at bringing you back than ever before. If this deep dive gave you a new perspective on your brain, share this video with someone you care about. We are building a community here that values deep understanding over surface-level facts. Check the description for the full list of medical sources I used today, including the ASA and the latest 2026 journals, so you can read further. Stay curious, stay healthy, and I'll see you in the next one.